China is experiencing a surge in human metapneumovirus (HMPV) cases, leading to overcrowded hospitals, particularly affecting children under the age of 14. Health officials report that HMPV, a respiratory virus similar to the common cold, is causing flu-like symptoms such as cough and fever, which can escalate to bronchitis or pneumonia in vulnerable populations. Despite viral videos depicting crowded hospitals, experts emphasize that HMPV is not as severe as COVID-19, and the situation is manageable with established precautions like hand hygiene and avoiding close contact with the sick. Neighboring countries, including India, are monitoring the situation closely. 2 infants in India have tested positive for HMPV, though health authorities state that these cases are not linked to China and do not involve international travel. While Dr. Abdu Nasidi, health expert, now joins us for a discussion on the HMPV virus resurgence in China and its likely impact on Nigeria. Thank you so much for joining us on Newsday.
Thank you. Nice to be here again.
Well, of course, as we said, there is a new global health emergency indicating another outbreak. Can we call this another outbreak of COVID in Nigeria, or is it, less severe, as some experts have said?
Well, definitely this is not COVID, even though the viruses causing the 2 diseases have similar behavior epidemiologically, but biologically they are distinct, and it's an outbreak, not yet a pandemic. They are all located in few countries, and that actually the cases seen so far have been less severe than the cases caused by the COVID virus, the coronavirus.
So what measures, should Nigeria be worried, about this new virus, and what measures can be put in place to prevent, a breakdown in the health sector?
We should be worried, but not panic. We shouldn't panic because definitely, there's no cause for alarm so far. The countries where it's occurring is located in known areas, and even though the virus was detected in the year 2001, its ability to cause infection in humans so far have been seen mostly in the winter, late winter and early spring periods in temperate countries. Only Kazakhstan, that is a little bit subtropical, that is showing evidence that it could be occurring in countries with hot weather. Nevertheless, with the international travel capabilities these days, a virus can jump from one continent to the other with ease through the planes, through the high-tech means of transport. So it's very possible to translocate this virus to any country at any given time if the countries are not preparing, to respond to eventualities.
So can you talk to us about some of the symptoms to watch out for and the risk factors? Where are those most vulnerable to this virus?
Yeah, well, the symptoms of this new HMPV virus or disease is actually similar to that of COVID. It starts with running nose, congested nose, fever, headache, and most likely difficulty in breathing. This is what it has in common with the COVID disease. But the other symptoms are common to is similar between it and the common flu, which occurs seasonally. The most important aspect of it is that so far no specific drug and no specific vaccines, even though they are working hard on vaccines. But and what worries us so far is that it's occurring in vulnerable groups of children aged below 5 years, and elderly people above 65 are mostly affected. Then most vulnerable are also people that are immune compromised, like people with HIV, and even people with severe malaria could be immune compromised and could also have a double infection with devastating results.
So, I'm talking about the treatment. Is there any need for antibiotics? You know that most Nigerians, most time, do like to do self-medication. Is this enough reason to go to the hospital for those having symptoms?
Yeah, especially if, so any person in the country that is experiencing runny nose, congested, nose and temperature, then is coughing, is sneezing, and then he's in contact with anybody who has actually come from these high-risk groups and countries, and they are from any country now, should go to the clinic. We should run away this type of stages from self-medication. That could be dangerous. This is what happened with COVID. We took it for granted, and by the time we knew, we realized that we are dealing with highly pathogenic virus that can cause, can be very deleterious, and can kill at a very high rate, with high case fatality rate. So, any sneezing, any flu-like symptom now, and in case such a person believes he has come into contact with anybody who had just come from abroad, should run away from self-medication. They should go to the clinic and seek for medical advice.
Okay, so well, what sort of complications could arise from this HMPV virus if not well treated?
Well, if not well treated, the complication we saw again with COVID is what will be coming. If there is problem with breathing, because just like the COVID virus, it affects the upper respiratory tract and the lower respiratory tract. So if it goes to the lower respiratory tract and there is difficulty in breathing, it might require intensive care, oxygen, and chronic dyspnea, and then it could also affect some other organs, and you can have pan-organ failure, so that could lead to death. So these are things that are making people to be saying, okay, we are worried, we are not panicking, but we are worried, we want to be ready. And the wise men said the best way to prepare for, to fight, for defense, the best way for defense is to prepare for war. So I think, luckily in Nigeria, we have all it takes to start, intensive preparation for this war, even if it comes. We have the NCDC, we have several laboratories now. I'm happy to at least note that just yesterday or today, the NCDC had met with all stakeholders, to sensitize all and activate or intensify our surveillance system, port health system, activate border screening, and also empower the laboratories in all the states that have international borders to enhance surveillance, and that is already activated.
Should we look at observing, the COVID protocols that were in place in 2019 in a bid to prevent this? Maybe the wearing of face masks, physical distancing. Will this help?
It will help if the disease enters into Nigeria and is established. That is, if it is now, or we have evidence it's already transmitting from human to human. And the unfortunate thing is that it's transmitted from jumping from human through the droplets to human, through touching surfaces, and so many, just exactly like COVID. That's what this is, but it's not yet time to panic as to be using face masks and also, but hand washing, social distancing, especially if you go to where there are so many people, you are not sure of this thing, you have your mask you can wear, but not outdoor this thing for now.
Dr. Abdu Nasidi, health expert, thank you so much for joining us on Newsday.